Now, in Scotland, there will be a return to the local tiers system. That comes from the 26th of April. Rules will be reviewed in Wales on the 12th of March. And in Northern Ireland, lockdown has been extended until the 1st of April.
We've also learned more this week about the next stage of the vaccine rollout, which comes after the over 50s have had their jabs. It's going to be focused on age rather than occupation, despite a lot of conjecture and debate about that. Meanwhile, infection rates of coronavirus have continued to decrease across the UK. The current R number, but transmissibility, is currently between 0.6 and 0.9, so about what it was a week earlier.
So it's that regular panel that we have on a Saturday morning with, to answer some questions, we've got the help of virologist Dr. Chris Smith and Professor of Public Health, Linda Bauld. Morning, both.
Hello. Morning.
Morning. Right, let's dive in, shall we? Because we've had so many questions, as usual. Mick has written in and says, I'm a bus driver. Linda, this is for you. I'm a bus driver who's worked right the way through the pandemic. Why are we not on the priority list to get the vaccine? Why have we now been forgotten about? Now, Linda, this was addressed with the press conference yesterday, wasn't it? Because obviously we had the JCVI lay out phase 2 of the inoculations.
We did, Naga, and I know it's causing people to ask a lot of questions. We've heard from the police, from teachers and many others. So this is a good question. The JCVI were very clear yesterday that there are two main reasons for continuing to prioritise for age. Now, we all know that the top 9 groups, which account for 99% of deaths and 80% of hospital admissions, are due to receive their first dose by the 15th of April and the second by mid-July. And now we're moving down first to the 40 to 49-year-olds and then below that. And the main reason for that is that if you look at the risk of hospitalisation and death, it is still highest in those in their 40s compared to others who are younger and in hospital. So by getting to that group next, we will prevent more deaths. That's very clear from the evidence, even though many of the occupations, like Mick's, are front-facing and have real questions. The second reason why the JCVI have decided to follow this is actually one of practicality. Finding all these occupational groups is tricky, not easy from primary care records, etc., and some might be missed. So it's much more straightforward and also crucially quicker to get those invitations out by age. Not all countries are following this model. I was looking at what Spain were doing, Indonesia the other day, but this seems to be the best way forward for the UK.
Linda, can I ask, you were listening to the conference yesterday. Now, Jonathan Van Tam said that if you want to be reassured, be assured that, and I'm surmising here, that you're in the queue for the vaccination. My immediate thought was, well, we've always all been in the queue. Why should this be reassuring now?
I think what he was trying to convey there was that by using an age-based approach, it's more straightforward to make sure that we can reach everyone. He also emphasized, Naga, as you know, that on top of those age categories, we still are more concerned about men, people from ethnic minority communities, those living in less affluent areas, and that GPs and others really need to encourage them to come forward. But I think everybody who's known to the NHS, and there are a small number of exceptions to that, we need to look at people who are not registered with a GP, etc., will get a letter, get an invitation. So I think he's trying to reassure the public that we will be asking you to come forward. And if for any reason people don't hear from the NHS, as we heard previously with that call from the Prime Minister to the over 70s, do get in touch with the NHS.
Of course, within minutes of the Prime Minister's announcement on Monday, holiday bookings went through the roof. They need to have had a COVID vaccine before they're allowed to travel abroad.
Not yet, but we don't know. This is under review because, of course, we don't really understand what vaccination means. Although we know it protects people from getting severe disease, and there's data out this week from a number of different sources, including at the University of Cambridge just yesterday, showing that people can be prevented from catching the infection asymptomatically and therefore also possibly passing it on. We don't know how long that protection lasts. We don't know whether it's comprehensive for everybody. And we also don't know when people are going to need boosters and how these vaccines are going to protect against different variants. But we don't know what it's going to be yet. And for now, there isn't one, but watch this space.
Yeah, because I think it was Greece, wasn't it, this week? They were sort of making very positive sounds about taking British tourists this summer. But I guess it doesn't just have to be internationally. Separate individual countries might come up with individual plans.
Get that data, and I think we will get that data quite quickly because we're vaccinating millions of people, we're following up millions of people, and there have been millions of infections around the world. So we're getting all the information. We just need to learn and learn quickly so we can make something that's practical, actually something people can understand and get behind, but it's also easy to implement around the world so people know where they stand.
We're all getting used to new ways of things, aren't we, doing things? Linda, Naomi has a question. Birthday parties. She asks, can I have a birthday party outdoors? Well, I think I can answer part of this, not that it's my job to.
I think lots of people are now doing what we did at the end of last year when we were in complex tiers or level systems, trying to look at the guidance, what's coming ahead, how does it apply to my personal circumstances? So we're going to get much more questions like Naomi's. So at the moment, as you rightly point out, Naga, we've been in the back garden with the family. But from the 29th of March in England, the plan is to return to this sort of rule of 6 outdoors, but a slight change this time, rule of 6 or from 2 households, because there's a lot of questions about, well, if you have really big families, then 6 is not enough. So from the 29th of March, what Naomi could do, and this is for recreation as well as for exercise, could meet with up to 6 people outdoors, potentially from different households, and there's nothing to stop them putting down a picnic blanket and doing that as long as they're following all the other guidance, which is obviously that distancing, really important, even outdoors, and the hygiene. So we are easing back into more of that social contact in the future if everything goes well. And we just need to keep our fingers crossed. We did hear, of course, from Jonathan Van Tam last night that although hospitalizations are reducing dramatically, deaths by around 40% over the last couple of weeks. Case numbers are still really high in some parts of the countries, but I hope for Naomi and for everyone that we can get back to that more social contact outdoors, as is currently the plan, not only actually in England, but in other parts of the UK.
Yeah, I don't know when Naomi's birthday is,
That's
but
the crucial question,
yeah, happy birthday
isn't it?
for whenever it is.
I guess some people are looking at a second lockdown birthday at the moment, aren't they? Painful side effect. He's asking, will he have those again with a second dose, or is the first dose the worst?
Just on the previous point, actually, about birthday parties, I did allow myself a chuckle when I realised. I did allow myself a chuckle when I realised actually that the Prime Minister's birthday is on the 19th of June. Just in time for the 21st of June, when, of course, all of the constraints on people getting together are lifted. I wonder if there's a coincidence or if there's actually some method in that madness. Now, in terms of, well, I haven't had my invitation yet, but I'm waiting, Boris, if you're watching. In terms of vaccine side effects, well, actually, I'm reassured by the fact that millions of people around the country and around the world have now had these vaccines. And the side effect profile is extremely reassuring. The number of people who are getting severe side effects is very, very low indeed. And as a result, I'm reassured that actually most people are not suffering severe side effects from either the first or the second dose. We don't know yet, actually, whether or not people who have more severe side effects the first time are destined to get less severe side effects the second time, or more severe side effects the second time, or indeed any side effects at all. My own feeling would be if you've made an immune response to the first dose of your vaccine, when you then get the second dose, probably actually your body will deal with it so quickly that any side effects will be fleeting. So I would anticipate most people probably will get fewer side effects the second time round, but time's going to tell.
Do we know yet whether either of the vaccines tend to have more side effects than the other?
We're watching, and the answer is that at the moment we have no clear picture on this. All drugs and vaccines can have side effects. These are no different. But I am reassured by the fact that millions of people have had both the Pfizer vaccine and the AstraZeneca vaccine, and they're reporting very trivial side effects on the whole. They're an achy arm. People do feel, in some cases, a bit tired and lethargic for up to 24 hours, and then most people feel absolutely fine. A brief straw poll among the doctors I work with, where we've all had Pfizer's vaccine, showed that about half of people had some side effects and about half of people had absolutely no side effects, apart from a slightly sore arm. One person I spoke to this week who had the AstraZeneca vaccine said she was absolutely fine, didn't even notice.
Brief one, Linda, if you wouldn't mind. Amanda asks, should I have the vaccine if I have long COVID?
long COVID. We think around 1 in 10 people continue to have symptoms post 12 weeks after having the disease, and we need to understand much more about long COVID. But in the Green Book, which is the practical book about immunisation in the UK, which PHE has updated for the COVID-19 vaccines, is very clear. Even if somebody has those ongoing symptoms, they should come forward for the vaccine.
Linda, Chris, it's always good talking to you both. Linda, you win this week. Not only do you have the fresh flowers, of course, but there's a variety of them. There are 2 colours, and you've matched your outfit too. Chris, seriously.
Yeah, but I have something else to show you, Naga. You remember last week, I can't remember, I think you were here last week, certainly John, we had a bit of an intervention by Chris around cactus things, and a very striking cactus. So I combed the house to see if we had any, and this is the only one that I could find. Now, it's not completely upright, and I think it's the alternative version of what Chris showed last week. I won't use any other nouns, but you can see he's a little sorry little fellow, but we love cactuses, and I just wanted to show that for cactus lovers as well.
It can always grow as well.
I shall have to up my game for next week.
Yeah, you will, Chris. You have to think about these things very carefully now. Chris, Linda,
I've got something I've got something I'm planning, so just watch this space.
Okay.
As long as it's not a party yet, Chris, we're fine. Thank you very much
parties,
indeed for joining us. We'll see you again next week. Great.
We're with you till 10 o'clock. And then, of course, Matt Tebbett. Have a good one.
Saturday Kitchen after us here on BBC One. Have a good morning. We've got the headlines coming right up.
Welcome to MasterChef. Let's cook.